I am struck by the challenges that we have ahead of us in thinking about rollout, and that we as a society have not done necessarily the best job in terms of getting our prevention measures in place, our response measures in place. And now we face an enormous challenge, but enormous opportunity to get this next phase right. And that we should really collectively all take part in the conversation about how we're going to roll out the COVID vaccine and who's going to get the COVID vaccine, such that we really can use vaccination as an effective tool to protect our communities.
Thank you. Rochelle, could we turn to you and ask for your thoughts?
Yeah, and I can be brief. I will say, I think history will judge how we handled this pandemic by how we treated our vulnerable populations, and how we made sure that people who, however we define vulnerable, socially vulnerable, medically vulnerable, and how we do this and do this right for those populations, I think is critically important.
Thanks. Mark?
Sure. I'm not known for being an optimist. My wife jokes that I have a resting grim face. But I think the news about the vaccines is really good news. It is the best news we could have hoped for, and presages even good news about future vaccine candidates, I think. So I think we do have an incredible opportunity, as Sarah said. And I think what we need to do, regardless of the vaccine, is form a greater sense of resolve as a community, as a country, and as a smaller communities, that this is a hard problem that we have to defeat with a whole bunch of different measures, and that the vaccine is an incredible tool, but it's only one, and it's not going to solve the problem immediately. So we have to keep our resolve up to reduce transmission with all the means at our disposal. So I'll close by saying, try to keep your Thanksgiving very local and very small.
Thank you. Thank you very much, Mark. And Barry, what can you tell us? How can you synthesize our wonderful 1 hour and a little bit more panel into a minute or so?
There's a photograph of a young African child that has touched me greatly, holding a sign that says, "Thank you, science." I think what we've heard today is that with the combination of efforts of investment in basic science, in the application of science to developing effective products, from the commitment of companies to make major risks to produce these vaccines, the science has come through for us. The real challenge now is to get public acceptance of the vaccines that will be forthcoming. And here I recur to the March of Dimes, which was a completely private foundation for the public good and eliminating poliomyelitis, and got almost all the children in the US vaccinated. It was a foundation. It was not the government. And I am looking forward at halftime to football games on Sunday to seeing advertisements not just for erectile dysfunction and plaque psoriasis, but on the importance and value of COVID vaccines to get into everybody possible to end this terrible epidemic.
Well, thank you very much, Barry, and thank you to the rest of our panelists. I think we just heard an argument in favor of a certain kind of DTC advertising, which I did not expect to emerge from our panel today. But thank you very much. So that concludes our event. I'd like to again thank our panel. This Q&A has been jointly presented by the Forum at the Harvard T.H. Chan School of Public Health and NPR. Look to the Forum website for more information on this and the future events. And you can always look to NPR both on the air and on the web for more information about coronavirus and COVID-19. Thanks very much, everyone.